Welcome to a new season of the Obesity Matters Wellness Workshop. My name is Rachel. I'm the Vice Chair of Obesity Matters, and I will be your host for this year-long program. Welcome, Sean. Thank you so much for joining us today, and thank you for being a part of the Obesity Matters community. I want to say, even before we really formalize this, you've always been there, and so it is an absolute pleasure for the first episode of this season to be with you. For anybody that might not know who you are, which is difficult to believe, do you mind sharing a little bit about yourself?
Oh, wow. Terrific. Thank you for asking me to be part of this initial session, this launch, this third year. It is easy to imagine. It should become this huge, monstrous thing that is just overwhelmingly filled with love and connected with so many people around the world.
The first thing I want to ask you is this phrase, my weight reflects my health. How accurate is this belief? And can you explain the relationship between weight and your overall health?
Excellent. Great question. And I want to break up a little bit about who I am, but just not blurbing on the whole time. But also, you should need to know that as I give you these answers, I run a weight management clinic. I run a clinical practice where I see patients on a regular basis. We have 17 doctors and an entire multidisciplinary staff. So that's what I do as my day job. I also do academic medicine. So I do research into the field, because we really didn't know anything about this field. So if anybody thinks that they know everything about the field, they're wrong. We don't, and that's why we do research and academia. So that's kind of where I come from, the lens of answering a number of these questions. I also was the lead author of the Canadian Obesity Guidelines. So when it comes to the idea of does my weight reflect my health, I believe that your health reflects your health. So, i.e., your blood pressure, if it's elevated, that's not good. If your blood sugar is elevated, that's not good. If you have pain in your knees, that's not good. I think that we should really a lot of times define our health by the parameters that are really specific to our health, particularly when you're in a first world country where you have access to be able to make a diagnosis, and to be able to get an x-ray, to be able to get blood work and to check it, to get a blood pressure cuff on. So we can do that here. That's what I think we should do. I think we should stop looking at it from a weight standpoint as a proxy for a person's health. Now, when it does come to understanding size, does size equal a person's health, or is it a proxy for it? And at times it can be. It can be. If somebody has 50 pounds, that size is a proxy for something bad that's going on, potentially a cancer, and the person is running into difficulties. If somebody has a weight that is significantly elevated with toxic fat cells that's causing their diabetes, that's causing a number of problems, then yes, that can be a problem. So what we do see is that as weight goes up, there is a higher propensity to these chronic medical conditions. So if we look at people with a BMI greater than 40, so BMI isn't a bad word. It's BMI is a numerical number, just like a person's height versus weight. These are just numbers. So as we look at this actual number of a BMI greater than 40, less than 5% of people with a BMI greater than 40 don't have any medical conditions. That means 95% of them do have some pre-diabetes, some pre-hypertension. So it means by that stage, a number of those cells, those fat cells, are toxic fat cells and have caused a bit of a problem. But this is still varied. There's a wide range here. I would really significantly say, even at that stage, measure the person's health, do their blood pressure, do their blood work. Everything is pristine. My answer more so is that health reflects health. Do the health parameters and don't just think about weight as an actual proxy.
I think that might be a trending phrase after this, Sean. Even in the comments, someone said, "Amen, your health reflects your health." So true, so true. Many people think, and certainly myself included, I think probably before I was part of this community, really, sometimes I would think my weight is my fault, especially when I diet and I don't lose weight. So how does the science of obesity medicine and weight management challenge this idea?
Sometimes I use the analogy of Vegas. If losing at Vegas is your fault, then no, it's Vegas is designed for you to lose. You're supposed to lose. So of course here the idea is your weight is not your fault. Your weight is under genetic control. If you think your eye color is your doing, then you're obviously wrong. We know that your eye color is a genetic. There are genes connected to it. Now, when you do that analogy, you're like, yeah, but I have no influence on my actual eye color. I have an influence on weight at times. And that's the thing that throws us into this quandary, because at times we do have some degree of an impact on the ability to change the weight. We have this control with our executive lobe to change it. It gives us this impression that we have the control of our weight and we are dictating it. That little bit of control gives us the wrong impression that we have total control, and that is actually wrong. We have a little bit of control of how long you open your eyelids for, but eventually you have to blink them, right? So don't let that little bit of control push you away from the understanding of the genetics. So if you have two family members, a mom and a dad, both living with obesity or elevated weight, the chances that a child will have elevated weight are almost 99%. So it's poly genes, the number of, there's not one gene, two genes, it's multiple genes that end up dictating it. And that dictates the behavior. Our behavior is a genetic thing as well. The way we laugh, the way we move. You go, oh, you move just like your sister does. Oh, your laugh is exactly like yours. I can't believe it. It's so cool. Our movements, our voice, our behaviors, and that behavior, may it be a movement behavior, or I like this type of activity, or I like these kinds of foods, or I have these type of cravings, etc. Those are genetic also. Right, so I think in a sense, can you control do you have some degree of capacity over your genetics? Yeah, we do. We have a little bit of control, and there is some capacity there to make actual changes. So just because your genes dictate certain things, it doesn't mean you can't do things about it. And the way I liken this, we have to remember that as well, familial hypercholesterolemia, cholesterol that's elevated, it's a familial thing, meaning it is a genetic thing, and your cholesterol is super high. So it means that you are likely going to have a heart attack at age 50. So back in the 1940s and 50s and 1930s, if you had familial hypercholesterolemia that was passed on by your mom or your dad who didn't die of a heart attack before they had you, and they had you, now you've got it, you're going to die of a heart attack, likely at age 45 or so, until the 1970s. In the 1970s, something happened. We found a medication that went into the cell and stopped that production of that genetic elevated cholesterol that was going to cause the person to have a heart attack. The person didn't change, but that medication changed it. Now they live until they're 90 because a medication changed their ability. They still have to eat well, do the right things, go exercise, have a good life, love and be loved. But that medication was able to stop the genetic predisposition of hypercholesterolemia. So we do have an impact on things that we can change that are causing a problem. If you have a genetic thing that doesn't cause a problem, don't change it. It's beautiful. If you have a genetic condition that causes a problem, we can look for solutions and answers through science.
I think that's helpful. I mean, there's so much in there that really highlights the fact that there's much of this which is outside of our control, but thank you for giving us some ideas of things that are in our control, and asking for help is also in our control, right? The next question. There is a common belief that losing weight is simply a matter of reducing calories. What are the complexities behind weight loss that make it more than just calories in, calories out equation?
You need to reduce calories to decrease weight. So that's an absolute. There's just no way around it. But it's not simple. The question was losing weight simply a matter of reducing calories? Losing weight is a matter of reducing calories, but it's not simply a matter of reducing calories because it's not simple. So is being monetarily rich a matter of having $10 million? Absolutely. If you have $10 million, you are monetarily rich. But is getting $10 million simple? No, it's not. That is the issue. We do have this idea, biological principles, that you do have to decrease calories to decrease weight. But that whole process is complicated, and it should not be reduced. And so this reductionist theories that we've been doing for a long time, for 50 years or more, is just simply do this, just simply do that. We'll reduce it to the easiest answer. Politicians try to reduce a bunch of complicated, complex things to a simple, we'll do this and it'll solve it. And then they get in and they can't simply do that and it solves the problem. So complex questions should be answered with complex answers. So weight management is a complex question and a complex biological and psychological process and needs to be answered with complexity. So anyone who tries to reduce it into one diet, to one exercise program, to one hormone, to one micronutrient, to one concept is going to fail. I think the humbleness, the humility to recognize that there's so many facets and to weight management, weight maintenance, to energy balance puts us in a position where I'll never answer that question with a simple answer. I'll always answer it with the complexity of it's hard, you're loved, and you're cared for. And with that difficult challenge, you will be supported in all of the different answers. But it's not one answer, it's multiple answers. But it does have to start with love and compassion because it's very difficult to tackle all of those things without understanding that aspect.
Touching on medication again, some people believe that taking medication to help with weight loss is cheating and that they should be able to achieve their goals through willpower alone. What would you say to those struggling with this belief or just holding this belief?
I think this goes back to the lack of understanding or accepting that this is a biological process. And I know there's a number of people on the line now, there's 100, and for sure, 100 people do not believe me when I said that it is a genetic process and there's a biological process and still believe that there is a significant amount that they can do because either they did it or their friend did it or whatever the case is. I get it that the biological principles are not always accepted, right? But when we do recognize that there is a biological aspect to it, and that some people struggle beyond the ability to do it through a executive lobe willpower aspect, right? It may not be the person that I'm talking to, but it's a lot of people. If you recognize and you're compassionate towards those people, and they start to have compassion towards themselves, saying that this is beyond me, I've done a lot, I've tried, I know that this is a biological process. Then they can say it's just like the genetic high cholesterol. I'm like that genetic high cholesterol person. What should I do? Should I willpower myself to get that cholesterol down? Should I eat that much more, fewer fat? Well, it's not eating the fat that's causing the problem. It's the internalized process of producing the cholesterol through the actual cells. Or do I take the medication so I can not have a heart attack and I can live for my family? I think I should probably take the medication so that I can live. I think that that's the same process here. Taking a medication is not cheating. It's a recognition of biology. It's a recognition of science. It's a recognition of compassion, of internalized compassion. Get rid of the internalized bias that you're the problem, that's all about you. It's kind of egotistical to think that you're the only person, no, it's only your executive lobe that can actually fix it. It's egotistical to think that there's no science or biological principles that are connected to the way you are, that it's all about you, that God and science didn't have anything to do with this. And if you do, then you recognize that there can be interventions that can speak to those aspects that we can't speak to, and that can help us to be the best self that we can possibly be.
Thank you for saying that, because that's not necessarily what we see all over social media. Thank you for setting us straight on that one. Last question, actually, which I think is great timing because there's lots of wonderful comments and questions in the chat box. But the last question I have for you, what is the most important message you would like people to understand about weight loss and self-compassion, especially in a society that often emphasizes willpower and personal responsibility?
I kind of struggle with the willpower and the personal responsibility because I think that comes second. I think those trying to force yourself to do more and to have more responsibility and beating yourself up comes from the lack of self-compassion, the lack of self-love, the lack of self-recognition. Whoever didn't give you that love, either when you were growing up or didn't let you know that you were important and you were cared for, you need to find it somewhere else. Maybe right here. You're loved and you're cared for. You're important. So wherever you need to find it, to let yourself know that that's the most important, everything starts to really change. You start to look at health is what defines health. So you don't look at your size as defining health. You go and get your blood pressure done. You go and get your blood work done. And if that's all healthy, then you define your larger body as just the most beautiful body you can possibly see. There's no willpower now needed to what? To stay a perfectly wonderful human being. I don't think that you need to correct things that are not broken. If there are things that need to be fixed and there are some challenges, then there's a team of people. And I assume that everybody on the line here has paid their taxes. If you paid your taxes, you paid for the system. It's your system, you own it. Yet you demand care. And you don't have a doctor, demand one, find one. That's your responsibility. That is the willpower you need to use. I'm harder on people when they are trying to get the actual help. And if they're not trying to get the help, it could also be depression and other challenges, and we need to help them to get past that, right? Once you're past that, then go towards a system that you paid for, you own it, you can get the help, you can get the coordination and as many things as possible, or advocate for it. If you're not getting it, it's because the person you voted for is not doing it properly. Vote for another person or give them a phone call, advocate and make a change. So we're not about willpower and personal responsibility. We're about self-love, self-compassion, and understanding that you can manage your health by measuring your health and taking care of it, because you matter. You matter to your kids, you matter to your community, you matter to the people next door. You matter, and we want you healthy, and we want you here.
Wow, that's a very powerful call to action.